Welcome to Medicalink. Don't forget to subscribe for more videos. Let's learn.
Hello friends, now we are going to talk about rapidly progressive glomerulonephritis. So why is it called RPGN or rapidly progressive glomerulonephritis? Because RPGN progresses to acute renal failure in matter of weeks or month. So it is also known as RPGN is also known as Crescentic Glomerulonephritis, as it is characterized by formation of crescents, which we will talk later in this video. And it is also known as extracapillary glomerulonephritis. Extracapillary, that is, crescents are formed outside the glomerular capillaries. Crescents are formed outside the glomerular capillaries. So it is also known as extracapillary glomerulonephritis. This RPGN or rapidly progressive glomerulonephritis is of three types: type 1 RPGN, type 2 RPGN, and type 3 RPGN. Type 1 RPGN is systemic disease, that is, it is anti-GBM type, where antigen-antibody complex are formed in situ against a fixed antigen. Type 2 RPGN is post-infectious RPGN, or it is immune complex type, where antigen-antibody complex is formed in situ against a planted antigen. And type 3 RPGN is pauci-immune RPGN. So RPGN is of three types: type 1 RPGN, type 2 RPGN, and type 3 RPGN. Type 1 RPGN is anti-glomerular basement membrane type, type 2 is immune complex type, and type 3 is pauci-immune type. So in coming to type 1 RPGN, type 1 RPGN is seen in Goodpasture syndrome. In this case, the fixed antigen is alpha 3 chain of type 4 collagen of the basement membrane. So human body will recognize this antigen, which is a self antigen, that is, human body will form antibody against own body's antigen, that is self antigen. Therefore it is an autoimmune disorder and it is a type 2 hypersensitive reaction. So the self antigen is collagen of the basement membrane, that is the fixed antigen. So antibody comes and forms bond with alpha 3 chain of type 4 collagen of the basement membrane. So the antigen antibody complex are formed in situ in the basement membrane, and this will result in the destruction of the glomerulus, resulting in glomerulonephritis. So the example is Goodpasture syndrome. So we see type 4 collagen in the glomerular basement membrane. This type of basement membrane is seen in the kidney as well as in the lungs. So in the lungs it is alveolar basement membrane. In kidney, Goodpasture syndrome will result in acute renal failure, which is the most common cause of death. And in lungs, it will cause pulmonary hemorrhage, which will result in hemoptysis. So in type 1, fixed antigen is alpha 3 chain of type 4 collagen of the basement membrane. So antigen antibody complex is formed in the basement membrane, and this will result in the glomerulonephritis. In type 2 RPGN, group A beta hemolytic streptococci will cause pharyngitis or skin infection, and the bacteria from these infections will enter into the blood and come to the kidney through the blood. Now this bacteria will get deposited on the visceral porocytes, so it becomes a planted antigen. Now antibody against these bacteria are formed in situ, and antigen antibody complex are formed in situ with complement deposition. This will result in subepithelial deposits, which is seen in the electron microscope. So subepithelial deposit was also seen in case of acute proliferative glomerulonephritis or post-streptococcal glomerulonephritis. So the example of type 2 RPGN is post-infectious glomerulonephritis, lupus nephritis, and HSP. In type 3 RPGN, type 3 RPGN is the most common type of RPGN, which will contribute to more than 50% of RPGN. Pathogenesis is not yet clear, and the majority of these patients are ANCA positive. They are ANCA positive and serum complement levels are normal. And anti-GBM antibody is also negative. Anti-GBM antibody is negative, and there are little or no glomerular immune deposits. So in case of type 3 RPGN, there is little or no glomerular immune deposit, so it is pauci immune. Pauci means less. So examples are Wegener's granulomatosis and microscopic polyarthritis nodosa. Now coming to the gross finding of RPGN. In gross finding, you will see large and white kidney. You will see large and white kidney. So the kidney is enlarged and pale with smooth outer surface, and the cut surface will show pale cortex and dark medulla. So in RPGN, kidney will be large and white, whereas in case of PSGN or APGN, the kidney was large and there were petechial hemorrhage, or it had flea-bitten appearance. Now coming to the light microscopy, crescents are found on inside of the Bowman's capsule. So you will be able to see the crescent. So crescents is the most histological finding of RPGN, and the number of crescents will correlate to the prognosis of the disease. So more the crescent, poorer will be the prognosis. So crescents are made up of parietal epithelial cells. So these crescents are made up of parietal epithelial cells. Fibrin is the most important factor, and neutrophils, lymphocytes, monocytes and macrophages. And the glomerulus will be overall enlarged, proliferative and hypercellular. So how are these crescents formed? So inflammation results in release of cytokines, which will cause rupture of the basement membrane. So you can see wrinkling of the basement membrane, and these cytokines will also cause endothelial damage. This endothelial damage will cause the release of procoagulants. This procoagulants will stimulate coagulation pathway, which will result in fibrin formation. This fibrin is pink in color. So the fibrin is the most important factor for crescent formation. So in light microscopy of RPGN, you will see glomerulus is enlarged, proliferative and hypercellular, and crescent is present. Whereas in light microscopy of PSGN, you will see glomerulus enlargement, glomerulus is proliferative and hypercellular, but there is no crescent in case of PSGN. Coming to electron microscopy is to look for the location of deposit. So in type 1 RPGN, you will see linear deposit along the glomerular basement membrane, as the antibodies are formed against the basement membrane. So you will see a linear deposit along the glomerular basement membrane. In type 2 RPGN, electron dense subepithelial granular deposits are seen. As antigen antibody complex are formed against a planted antigen within the porocytes, you will see a subepithelial granular deposits. Type 3 RPGN, you will see no deposit. Type 3 RPGN is pauci immune, and you will see no deposit in type 3 RPGN. Coming to immunofluorescence microscopy, you look for the composition of deposit. In type 1 RPGN, you will see a linear pattern, as the deposition is occurring on the basement membrane, so it is homogeneous ribbon-like pattern. So it is a linear pattern, and it contains IgG and C3 along the capillaries. Whereas in type 2 RPGN, it has granular pattern. So you see it is a heterogeneous granular pattern. So it has a dense granular deposit containing IgG and C3 along the capillary wall, and type 3 RPGN and type 3 RPGN, it has scanty or no deposits. So coming to the clinical feature, it will show a feature of nephritic syndrome and it will lead to acute renal failure. So this was all about rapid proliferative glomerulonephritis, RPGN. Thank you.